Researchers from the University of Maryland and the NIH have developed a new app that can predict the risk of heart disease in people over 40 based on their exposure to risk factors over time. The app relies on health data collected from 5,000 adults over 30 years. Among the findings, Black patients have a 46% greater risk of developing heart disease compared to white patients.
What we're trying to do is to link risk factors to outcomes and to do it quantitatively. So you can actually make a prediction for a given individual or for a population about the impact of cumulative, that is overtime exposure, to multiple risk factors operating simultaneously.
Biostatisticians analyze the impact of risk factors such as high blood pressure, obesity, and elevated cholesterol.
In this particular study, we started in 1985 when those participants are 18 to 30 with a median age of 25. So we follow them for 35 years, and we can actually see the progression of risk factors and development diseases.
The study found Black patients are also more susceptible to the cardiovascular effects of uncontrolled high blood pressure. White patients were found to be more susceptible to elevated LDL cholesterol.
I think the thing that really makes it different is we have developed mathematical models, equations, that you can just plug numbers into and estimate your risk. And the beauty of that is several things. Really, one is you can, in dealing with an individual patient, you can calculate risk and you can see what the difference in risk would be if they changed their behavior.
The results of the study could help guide physicians in developing personalized prevention strategies for individual patients.
The way to avoid cardiovascular disease is to not let these risk factors accumulate, so that the earlier you control risk factors, the less cumulative exposure there is and the less risk later in life.
For the University of Maryland School of Medicine, I'm Larry Roberts.